Hello and good evening, everyone, and welcome to tonight's webinar brought to you by the Early Career Nurses Network. We are going to be covering how to tackle your first revalidation, a super important topic tonight. My name is Kendall Andreasen. I am one of the professional leads at the RCN. I'm professional lead for acute and emergency care, but I also have the honour of looking after the Early Career Nurses Network, which I absolutely love doing. So I'm really pleased to be here tonight to host this webinar and to host some really fantastic guests, which I will tell you about in a second. But first, I will just linger briefly on the Early Career Nurses Network. You may know us as the newly registered Nurses Network. We've had a bit of a rebrand and shake up. We are trying to make sure that we ensure kind of continuity of support through that early career phase, hence the name change. Do let us know what you think about that. And so that's that. So I'll move on to the next slide, please, and talk to you about the lineup. I've said who I am already, but we've got some great colleagues with us tonight. This webinar is going to run for an hour. I can see there's a question on the chat that says, will it be recorded? It will, and you'll get a notification when that recording goes live so you can watch it back. But I do have some great colleagues with me tonight, three colleagues. Andrea Childe is one of the professional leads for education, and she's going to be talking to us about what the RCN can do to support you through your revalidation, with a focus on RCN Learn. And then we've got Lucy Tomlins, who is also a professional lead for education, and she is going to talk you through the super useful online portfolio tool. So hopefully those two things will be of great value to you. And then we have Edward Toogood. He is an RAF nurse who has very recently revalidated. I'm really excited to hear from him because I think he's going to be able to give you a lot of really great lived experience and give you some practical tips. And it's always useful to hear from someone who's just done it, isn't it? There will be time for a Q&A. Everyone's going to speak for between kind of 10 and 15 minutes, so there'll be plenty of time for a Q&A. So please do use the chat function, as some of you are already doing, to introduce yourselves if you like, and to pop some questions in the chat, and we will get to those at the end. I have already told you it's recorded, and so I think we're up to date. So revalidation, as you know, you need to revalidate every 3 years. There's a whole series of things that you need to do as part of that revalidation. Make sure you get 450 practice hours, do 35 hours CPD, 5 reflections, 5 pieces of feedback, etc., etc. And we're going to talk about some of those as we go along. But I think I'll probably stop nattering away, and we'll get to some of the good content from my brilliant colleagues, who I am very grateful to for joining me tonight. So, Andrea, may I pass the mic to you?
Hi, thanks very much. I'm really pleased to be here. I'm Andrea, and as it says on the screen, I'm a professional lead education, but I'm also a registrant for adult and paediatric nursing. And you can clearly tell I've been in nursing for quite some time, but revalidation, I still have to remind myself every 3 years. So hopefully the speakers I've got on tonight will give you some hints of tips of how it feels in the real world, and how we can make it easy for you and how we can support you. So thanks for choosing nursing. Stay with us. It's fabulous. It really is. So I'm going to start by talking about RCN Learn in a moment. And this will relate to some of that CPD, that continuous professional development that you need to demonstrate on revalidation, that 35 hours, of which 20 has to be participatory. But there are lots of different kinds of CPD. You can be shadowing someone, you can be attending an event, but the RCN Learn online one-stop shop is where all of our learning is. So I'm going to do a live demonstration, and as I go along, hopefully I'll bring it to life and you'll all be rushing to use it. I just want to give you my top tip first. I keep my forms to my RCN revalidation, which are in one continuous form. I keep it on my desktop and I put myself a notification in every month to see if I can fill some in going along. So I might have gone to a bite-sized learning, I might have gone to a webinar, I might have been shadowing someone and had a reflective feedback. So try and fill it in as you go along. So I'm just going to share my screen with you, and my colleagues will put RCN Learn in the chat so you know how to access it. In a moment, I'm just going to ask my colleagues, can you see my screen, colleagues, demonstrating RCN Learn?
Yes, I can see it.
Thank you. So as you can see, it's rcnlearn.rcn.org.uk. You can also access it directly from the screen on the normal RCN website, which you can access here. For ease, I'm already logged in. But RCN Learn has something for everybody. We had many engagement events with members and stakeholders when we created RCN Learn to find out what our members wanted from us. So around 70% of all the resources on RCN Learn are for members, RCN members, but there is around 30% at any one time that's free to the global nursing, health and social care workforce with a simple login. So there really is something for everybody. So a walk through. As you can see, it is for RCN Learn, is a little bit about what it is, and it is for everybody in health and social care. Around 80% of our resources are for all grades, levels, roles across the independent, the NHS, anywhere you work as a nurse. It's up to you where you feel your learning sits and what your requirement is. So do have a walk through. I will just demonstrate in the help section here. Because this is a whistle-stop tour, you can have a look at some of the frequently asked questions. They're super helpful, and how you can get in touch with us if you've got any issues. If you can't remember your RCN number, because of course you can't remember your RCN member number, just put in your email address and reset password. The question we receive a lot is that it's not come back to me. And the issue is if you're using your employer email address, it will usually go to your spam. So just check there, and very often you can reset from there. But it's such a frequent question, we do like to mention it. Coming back to RCN Learn, you can use our enter keyword. So anything you want to enter here, or you can view all courses and resources. But for speed today, I will be using just this simple search bar here. You can access the clinical resources here, and I'm going to come back to the courses and programs. So thinking we probably have a generic audience in today, I'm literally going to type in diabetes and return and see what resources are available. You'll see that you can also search by topic if you wish to, and the taxonomy is applied over quite a few. So there might be 2 or 3 taxonomies if you're looking for diabetes in children, for example. There'll be joint taxonomies. You can also access content if you are a free logged on user. So that 30% that's free to the world, you can create a really simple and quick free to registered users. If you're a member, you can access both. So the free and the member. On the learning type, you'll see there are course and resource for simplicity. The resource is clinical information that you might want to learn a new subject, refresh yourself. It might be something new that you want to do, spend a reflection piece on as part of your own CPD. So those other CPD hours out with the 20 where you need to be participatory. So let's have a look what diabetes has brought up for members and non-members. All the tiles are the same, so once I've explained one to you, you'll know which tiles to look out for. We can see here Diabetes Essentials is a resource, it's a clinical resource, and it's available to everyone. And this is because it's a collegiate piece with Diabetes UK, and we can't put that behind our membership. It has to be free to everybody. So let's just click on it and have a look. It's all the same, so you'll get used to the format. It'll give you a 1 sentence just to give a punchy headline of what the tile is around, that it's available for everybody, and who is that everybody, what are those roles, what it will give you, when it was last reviewed, and if you want to contact the resource lead, which is Callum in this case, you can email Callum with ease. So let's view the resource. So in this style is a concertina style. You can clearly see it's our collegiate work with Diabetes UK. This is a different style. You work through many of the boxes. You can see on left all the sections, the types, the symptoms, medications, testing, screening, complications. So that's the type of resource for this one that's free. I'm going to go back to RCN Learn. I'm going to go back to diabetes. As you can see, it's just trying to get back. It's the internet for me. Apologies. And we'll have a look at one for members so you can see how different they are. We'll click on Overview of Diabetes. You can see it's clinical resource and it's available to members only. I'm already signed in, so I will see the whole of the resource. It's the same format. And if we view the resource, it's a different style. You'll see there's lots of clinical information. And many of our resources have other links on, so it will link to the particular forum for that subject matter. It'll link you to the diabetes subject guides. And if you've not used the subject guides in the library, please have a look. I think there's around 68, and they are a whole plethora across clinical practice of where there's so much information in a one-stop shop from the library. And again, you can contact Callum should you wish to. I want to go back to RCN Learn now, so I'm going to show you if you want to look at where the courses and the programmes, the more formal learning. So I'll click on the main educational programmes. You'll see here we have a fitness to practice course, and again all the tiles are the same, so you know what to look for. We have a leadership programme for every level, so level band 2 to 4, band level 5, 6 to 7. We have a demonstrating value that's for everybody. Some of our programmes we run independently, and you can buy your own place, or your employer can apply and buy your own place, or your employer can commission a whole cohort if you're interested. We also have a CPD course for infection prevention and control. So there's lots to have a look at. So the main takeaways for you are, if you can't log on, reset your password, but remembering to check your spam folder if you're using your employer's email address. Have a walk through, see what you can have as a member, see what you can access as a quick log on, free registered to the Globe. So that's a whistle stop tour. And Lucy, my colleague now, is going to come on and talk to you to find the portfolio. And this is where you will find it. Thank you, Lucy. I'll stop sharing.
Thank you very much, Andrea. Excuse me. Okay, so my name's Lucy Tomlins. Like Andrea, I'm in the same team as her. I'm professional lead for education at the RCN, and I come from a midwifery and nursing background, psychology and education as well. So hence I've ended up in the education department at the RCN. So I'm also delighted to be here and share with you the revalidation portfolio. I'm going to share my screen in a minute as well. Excuse me. And hope, fingers crossed, that it works. So just let me know if you can actually see the screen.
Yeah, I can see the screen.
Fabulous, thank you. Thank you, Kendall. Waiting with bated breath there. Okay, I know you can't see a lot at the moment, but I'm going to give you a bit of a whistle-stop tour, like Andrea, of the actual RCNI revalidation portfolio in association with RCN Learn. I will call it, I'll refer to it as the revalidation portfolio, or it gets a bit wordy, obviously. But it was built in conjunction with RCNI, hence why we've got this very long title. And I just want to distinguish between the revalidation portfolio, which is accessible to our registrant members, so anybody, any of our members who re-register with the NMC, as opposed to just the RCNI portfolio, which is for all our members who do not register with the NMC. So we have an e-portfolio for all the membership. When you actually log on, Andrew just pointed to the portfolio button on RCN Learn ribbon, when you actually log on, if you haven't already done so, it will prompt you to develop or begin developing a portfolio. If you already are a registered member at that stage, it will take you to the right portfolio for you as well. But you do have to register first, obviously. So the revalidation portfolio is an online portfolio tool which now comes free with your membership, and it complies with the Nursing and Midwifery Council's requirements for revalidation by organising evidence, documents and calculating the hours spent on CPD and tallying reflective accounts. It'll help you keep on track by using progress bars to show you at a glance how close you are to having all the information you need to revalidate. So it's your all-inclusive revalidation resource, easy to access on any mobile device. As I scroll up, I'm going to scroll up a little bit, up and down a little bit, just to show you as I'm going along. That's the progress bar, which gives you overall information on how far you've progressed with the completion of your portfolio over the 3-year period. So each NMC requirement has its own section on the portfolio. So this is the page you'll see as soon as you start developing your portfolio or you'll log in. And all the tiles there represent all those NMC requirements. So it makes it easy to upload and amend your work, and certificates and documents also have their own area to help organise your supporting evidence. And again, right at the bottom there, you can download the whole of your portfolio into an easily transferable and organised PDF document at the end of it, and we'll come to that in a minute. Okay, so the most important bit really to start off with that you'll need to know is that you have to know the date of your registration, or rather you have to enter the correct date of your registration, because the portfolio is really only, it will revalidate with you. So once you've completed one, it'll sort of complete that one and then give you the option to start the next one. And as you can see, where I'm messing about with the on the right hand side here, you can see my mouse. This particular portfolio, even though it's a test, so the dates don't align, don't worry about that. It's showing that there are 3 portfolios in this test. So however many portfolios you developed over the years, you'll be able to access them, and the one that's highlighted is the live one. So very important that you know the exact date and you enter the exact date of your registration and you get your registration number in there. Okay. So you'll be prompted to create your revalidation portfolio, which will then populate with your name, your NMC registration date, and the number at the top, as I've just shown you there, along with the overall progress bar. And by the logo, you'll see links to the guide. It's only in tiny writing there, but just under the logo, there's this option there to access the guide. Now, the guide is very, very comprehensive. It's literally a step-by-step guide. So if you're struggling at all, click on the guide and you will basically be taken through the steps that you need to go through in order to complete the portfolio. Overall, the progress bar, as I say, shows how close you are to actually completing all the evidence for this validation period, but also these individual tiles also have their own little progress bars on them, so you can, it shows you at a glance essentially what you still have to do as you're going along. So managing each section. So each tile or section has the option to view or add, and viewing is where you can manage your entries to that individual section and edit, delete or add as needs be. And if you want to simply just add and upload, you can click on the add section and follow the prompts. We're just going to have a look at the individual CPD where it says add there. So you get a page, and again intuitively allows you to, prompts you to fill out all the different aspects. So title, date, the method of the course or whatever you're undertaking, CPD activity you're undertaking, that has a drop down box to choose from, and then you can give a brief outline of the key points of the learning activity that you've undertaken. It then also allows you to identify the parts of the code that it's relevant to and the nursing standards, or the NMC standards, I should say there. You can also put in the hours that you've done on that particular CPD activity, and if you need to upload a file or a relevant documentation before you save, and then again that will then be captured on the progress bar. I just want to point out to you though on this little section that the little red asterisks there are the things that are mandatory, and they're NMC mandatory, and you'll see that on each of the different tiles as you go along. Okay, so uploading forms and documents, etc., onto the tiles or into your portfolio. You can do this one of two ways. You can either download forms from your computer, fill it in, save it to computer and upload it to the correct section, or you might have to print it out, physically sign it or whatever, and then scan or photograph it to upload. And again, each one of these, well, let's go into another one, reflective accounts here, very similar format, title, etc., have also embedded within them the NMC forms, which are mandatory for you to use. So particularly in the written reflective accounts, you click on that and it will bring up the form. So you can either do it via the tile, or you can go back up to the top near the guide element there and click on the forms there. So all the NMC forms that are mandatory are embedded into the different tiles. And I appreciate I haven't got time to go through all the different tiles, but they sort of look the same, and it's rather a game of sort of navigating around and finding out what you need. So again, like I say, all these different elements are captured, and they all work in very, very similar ways. Just a couple of things that I want to mention. We've sort of divided the individual CPD and the participatory CPD. So Andrea mentioned before that you need to do 20 hours of participatory CPD, and you can see that it's been captured on this progress bar that somebody's already added something to that, which leaves the 15 hours earned through individual CPD. Each one of the tiles will also give you information on exactly what is required within those little tiles and within those requirements of the NMC. So not only do you find it in the guide, but you'll actually be prompted within each tile as well. So it does make it very accessible for filling out or completing. What else do I want to tell you? A few more things that are quite important really for you to know about. One is obviously the confidentiality element, so don't be putting anything that's confidential about specific patients, service users or whatever in those tiles, or using anything like that. You're going to use pseudonyms, etc. if you want to do anything like that. And the other thing really is that people don't seem to realise, or sometimes get stuck about, particularly it's the first time you're doing it. Remember, you aren't presenting this whole portfolio to the NMC. What you are doing is you are getting somebody to confirm that they've seen and talked through with you everything that you've done here. And so you're essentially just confirming to the NMC that you have completed this. You need the portfolio, and I would suggest that you do download it into a nice format, so that in case the NMC is auditing and requests your portfolio, you have it on hand there, but you don't necessarily send it off. And remember, it isn't the RCN that would ever send it off either. We're giving you a resource so that you can complete this in anticipation of potentially an audit, but certainly for your revalidation. So you're solely responsible for the content, the completion and the download and submission, if it's required, of your evidence for the revalidation if the NMC require it. I think I've probably taken up my 10 minutes and gone over, and there's so much more I can say, but I know our next speaker is going to go into a little bit more detail. So please, if you've got any questions, I'll be very happy to answer them from the chat at the end in the Q&A. But thanks for listening. I'll stop sharing, she says, hopefully. There we go.
You have. Thank you so much. They were both really useful. Thank you so much. I actually got my NMC notification this week that I need to be prepared to revalidate this time next year, which was really alarming when I got it. I was like, that's really early. And I'm kind of 60% through my portfolio. It's a really useful tool to kind of keep on track and kind of deter those last minute nerves when it comes to the deadline approaching. So that's really useful tool. Thank you so much. And thank you to Andrea. The RCN offers so many different sources for CPD. Lots of those courses are created by myself and my colleagues and Lucy and Andrea's colleagues, and they're really put through a very thorough quality assurance process, so we know that they are really great resources. So do use all of the great stuff that's on RCN Learn. So thank you both for that. I am going to hopefully pass over to Edward, and he is going to talk us through how he tackled his first revalidation. I don't know if you're able to come on screen. Here he is.
Yeah.
Okay.
Yeah, can you hear
over
me?
to you. Yes, I can.
Brilliant. All right, let me just sort this out, and good to go. Brilliant. So yeah, hello everyone. So my name is Edward Toogood. Sorry about the echo. So I'm a surgical and trauma nurse with Defence Medical Services, and today I'll be sharing my personal approach to completing my first NMC revalidation, and I'll share what worked, what didn't work, and some practical tips that may help you along the way. Next slide, please. So first of all, the aim of this is simply to break down the revalidation into manageable steps for you, highlight common challenges, and give you some tools to help you through the process when it's your turn. Next slide, please. So I was going to speak about what revalidation has done, but the presenters beforehand did a great job doing that. But as it says there, as we know, every 3 years, we need to register again with the NMC to ensure that as nurses, we are showing that we remain safe, competent, and professional who uphold public trust. So it's very important that we ensure we hit all those targets. Next slide, please. So the way I approached my revalidation, so as you see here, I've got 3 sections: the milestones, the habit and strategies I developed, and sustaining it. So at the start, my first milestone is when I qualified in September 2020. From there, I set small checkpoints each year rather than leaving everything until the last year out of the 3. Because from there, it'd be quite a lot of work to try and get all my work into one portfolio. The habits and strategies I developed was to make sure that I started early preparation. So attending stuff like this webinar, ensuring that I speak to other professionals who've done it before to ensure that I know what I need to do. Secondly, the big thing about it is investing and building. If you start small and build it up over time, when it comes to revalidation, it's a lot less stressful process. And lastly, review and refine. So when it comes to the last stage, you want to ensure that you're hitting the target CPD hours, clinical hours, and all the other goals, and sustaining. So as I say, organise a portfolio. I highly recommend using the RCN portfolio. I use that myself, but again, you can also use your own folder and make it more authentic into the paperwork based. You can build in reflections during your period. So every time you do 6 months, you can ensure you do 1 reflection, and then by the time you get to the 3 years, you can complete your revalidation. Next slide, please. So the challenges I personally faced whilst doing my 3 years revalidation. First of all, it's time management. So I understand how time can really quickly fly past over 3 years. And because it's really far away in the future, you can very easily put it in the back of your mind and think, I will do it later. So it's really important that you keep track of the hours that you're completing, have it well organised in a portfolio, so it makes your life a lot easier. Because I've had colleagues who at the very end were scrambling to try and find how many hours they've done, CPD, scrolling back 3 years of emails, trying to find evidence of certificates. So once you get a certificate for CPD, or when you get your timesheet, have it in a nice organised file, or use your RCN portfolio and have it there. And as we all know, we get life events, things that we can't control in our life that happen that can make it quite difficult to maintain control. Again, this is why I say staying organised makes it a lot easier completing your revalidation. Next slide, please. So I'll break down each section of revalidation and do my highlights of do's and don'ts. So first of all, I recommend that you do log hours regular and ensure that you are completing within the 3-year goals. Link your hours to your scope of practice. So if you're a mental health nurse, if you're a specialist learning difficulties nurse, or the wide variety that we provide, ensure that what you do is relevant to your job. Use portfolios to help with your aids and keep evidence, so that your rosters, contracts and payslips. However, don't assume that your employer would control your hours and will track everything for you. End of the day, I'll answer the questions at the end and I'll continue flowing through this presentation, but I will get back to that. Don't leave login hours until the very last deadline. You do get memory phase, and sometimes all the hours can kind of merge into 1 month. Don't record unrelatable nursing hours. So there are people out there who have to maintain 2 jobs. Don't overlook part-time roles as secondments or breaks or bank shifts, because they still clinical practice within the NMC Code of Conduct. And don't forget to cross-check your total hours towards the very end. Next slide, please. Number 2, so 5 pieces of practice-related feedback. So ensure that you've collected feedback from a range of sources, whether that's from patients, carers, colleagues, students and appraisals. You can have recorded both formal or informal. Just ensure that you have some sort of evidence that you can provide for your revalidator to make sure that's on your profile. Note down what was told and, most importantly, how it influenced your practice. This will show your continued development as a nurse. And as alluded to beforehand, keep it anonymous. So don't break patient confidentiality, have mentioned trusts, and just use acronyms and pseudonyms if you need to. Don't wait until the end to think about feedbacks. Ensure that you speak to who's going to be your practice-related feedback assessor and find out who's going to talk to you about your 5 related feedbacks well before you have to submit your revalidation. So if I knew that mine's due in September next year, I'll ensure by January beforehand that's all sorted, so it's a smooth transition. Don't ignore normal feedback, informal feedbacks. It's often the most valuable. You can learn most from it. And don't just describe the feedback, show what you've learned from the process, and ensure that you keep it all organised so you don't have to chase around looking for it. Next slide, please. Oh, I've actually used the same slide twice. Whoopsie daisy. So anyway, so it pretty much is the same when it comes to CPD hours. So ensure that with your CPD, that you log down what was participatory and what you did in terms of non-participatory, such as doing online classes. Ensure that you do collect all this in a nice organised portfolio. You do log the hours and don't leave it to the last year to try and get all those hours sorted, because you'll be chasing on a lot. Luckily, when you're newly qualified during your process, you do a lot of CPD hours. So ensure you document it early first, and it makes it a lot easier when it comes to your 3rd year. Next slide, please. Oh, I did mention it. Apologies, user error. So yeah, ensure you complete 35 hours over 3 years. Include a mix of study days, webinars like you're doing today, and journal clubs, etc., etc. Record each activity, such as date, topic, hours, and the code it links to. continue showing your development, and save certificates right away in a nice organised area. Also, what shouldn't you do? Don't forget participatory hours. Some people do loads of hours with the non-participatory learning, but actually don't do anything participatory. So ensure that you've got time to do that. Again, as I alluded to earlier, make sure you leave all your information in a nice, secure place so it's easy for you to find, and don't leave it to last year. Next slide, please. So lastly, the health and character declaration. So this is about declaring your honesties and revalidation. So good health means that you're safe to practice with or without adjustments. Doesn't mean you have to be in perfect health. It just means that you've taken necessary adjustments to make it safer for you and for your patients. Understand good character. So honesty and integrity is very important. So ensure that your professional indemnity arrangements cover all your roles as a nurse, and keep evidence that covers it, such as your RCN membership, employee confirmation, and policy. What shouldn't you do? So make sure you don't hide your cautions or convictions. If anything does occur during your 3 years, just tell the NMC straight away, and it makes it a lot easier rather than them finding out. Don't think health declaration means that you're in perfect health, as I just alluded to, and don't assume that your employer professional indemnity covers everything. We'll answer those in the Q&As in a second. And don't practice without indemnity. If it risks your registration, ensure that you are covered. Next slide, please. Lastly, when it comes to the most important part, so when your confirmation's ready, do arrange that your reflection discussions are early. Share your 5 reflections with your confirmer and book your meeting as soon as you can. The earlier the better, because you've got time to make adjustments if you need to. And you submit via NMC online. Don't leave arranging it to last minute. Get your diaries all booked in. Don't treat reflection as discussion. Use it as a professional conversation, because I've had conversations that has improved my practice as a nurse. And don't assume that your confirmer will chase you. It's your responsibility. Next slide, please. Again, extra advice. This has been heavily covered on the presentation beforehand, but again, I highly recommend using the RCN portfolio. It made your life a lot easier over the 3 years, and you can have it all in one place that's secure. Next slide, please. So again, useful resources. So you can use RCN portfolio, NMC for your documentation, simple logs, usual book, write down what you've done, peer support for development, and NHS Trust revalidation teams as well. Next slide, please. Thank you for listening. So I'll answer those questions in the Q&A section.
Edward, that was amazing. Thank you so much. Would you like a job at the RCN? That was a really, really useful breakdown of exactly what you need to do to achieve revalidation. And some brilliant top tips for getting it done well and efficiently and on time. I really enjoyed your take-home message of don't leave it to the last minute, collect evidence, make sure you methodically tick off all of the various bits and bobs that you need to do in order to get it done. I think my top tip when I was thinking about this before we came online, it kind of reflects that. I think it's important not to pay lip service to it. We can be busy people, can't we? And that it can feel like an overwhelming task revalidating, but actually it's a really important part of making sure that we're competent and credible in what we do, and safe and able to provide good patient care. So do it in good time. Do have meaningful, reflective conversations with your colleagues. All of those things are really, really important. Thank you so much. We've had some brilliant questions, which we'll start to go through now. I've had a few more questions about whether it will be recorded. It will be recorded, please don't worry. And if you've signed up to this webinar, you will get a notification of when it will be released. We've answered some questions as we've gone along, but I'll start just saying some out loud, and if I can get a little wave from one of my colleagues who's happy to answer them, I would love to hear from them. So one of the questions is it possible to revalidate after a few months out of nursing? So I think this means if you've had to have a career break, perhaps for maternity, or you have been unable to work for whatever reason, what is the deal when that happens? If some colleagues could come on the screen and give me a wave. Yes, Lucy, please come on in.
I'm jumping in because I just answered one on the chat, actually, Kendall. Yes, so if you do take time off for maternity or for whatever reason, you still have to revalidate within the 3 years and with the same amount of time. So you need to keep tabs on how many hours you do around that, and it is quite possible to still meet the requirements within the 3 years, and even if you do take that time off. So yes.
Yeah, because we're talking about 450 hours, aren't we, for a single registrant, so someone who is a nurse alone, not dual registrant, which is actually really easy to achieve because sometimes we work quite long weeks, don't we? So but if you are on maternity leave, it's definitely something you probably want to just keep tabs of, because it'd be awful to fall foul of that. Thank you, Lucy. So, sorry, is revalidation portfolio only available to RCNI subscribers? It's available to all RCN members. Please correct me if I'm wrong, any colleagues, but that is the case.
Free of charge, part of the membership.
Yeah, and super useful. I love the little bar across the top that tells me how far I've got to go. It gives you a percentage of how much you've achieved. It's like a game.
Can I just mention, though, you can still subscribe to the RCNI. And there is, you might have seen on the RCN, on the portfolio there, that there is a tab or a tile which allows you to subscribe, and therefore you would get access through that subscription to a huge amount of other online material, which you can use for CPD and actually would automatically populate your portfolio as well.
Super, thank you, that's useful. And we've had a few questions about, do we need a certificate for every CPD hour you log? And actually I think someone else asked, my employer doesn't provide certificates. Does anyone have any opinions on that?
Thank you, Kendall. I've popped a reply in there. It's about using your reflective practice and keeping those outcomes from that study day, So if you don't have a certificate, you can identify of what you went along to learn. You can write in your revalidation reflection how you learned and how you're going to underpin your practice or enhance your practice by attending that learning. And that's part of your revalidation. Thank you.
That's super useful, thank you. And somebody did ask if this session counted as an individual CPD. Yes, it does. So if something is participatory CPD, everyone's using the chat there, they are participating in a professional discussion. So therefore this does count as your CPD. And another question, does the evidence collected need to be from one job specifically, or can it be over 2 jobs? It can be over as many jobs as you like, as long as you're using your professional registration.
Hi, Kendall. Someone asked the question, if you're dual qualified, how many hours you need to log? So it's 450 hours per speciality. So if you're just a registered adult nurse, it's 450 hours for that speciality. If you're dual qualified, then it's 450 hours in that one as well. So technically 900 over the 3 years, but 450 per speciality.
That is perfect, thank you. And it's super clear on some of that. We've put a lot of links in the chat, and if you scroll back through there, or even just if you Googled NMC revalidation, you would be able to find that out super easily. And it gives you a really nice list of exactly what you need to achieve. Can I use the in-hospital training hours as my individual CPD? Would anyone like to answer that?
Yeah, so you can use mandatory training if that's what you're alluding to, if it is relevant to your scope on area of practice. So if you were doing fire training, for example, no, you can't use that because that's everybody's bag, isn't it? We all have to do that.
Mm.
If you're doing something that might be safeguarding and that's going to inform your practice, then yes, you could use that.
That's a really useful distinction. Thank you. I hadn't considered that, but yes, that would certainly be the case, wouldn't it? So this is useful. Once you have filled everything out on RCN Learn, how will you transfer all of that to the NMC portal? That's useful to dwell on because you wouldn't want to get that wrong. Thank you, Lucy.
Okay, so RCN Learn is the platform for learning. The actual revalidation portfolio is the portfolio you're talking about. So that's accessible through RCN Learn. So the two separate things, okay? The portfolio sits within RCN Learn, if you will. Once you've completed all those tiles on the revalidation portfolio, you can download the whole thing on a PDF document and keep that document. You don't actually submit anything to the NMC, your registering body, from that document other than the signatory and the confirmation that you've completed it. So when you actually go onto the NMC website, or when you get the NMC prompt to revalidate, you only have to submit confirmation that you've done the portfolio. You don't submit the portfolio itself at all. But you have to keep it there on hand, standby, just in case the NMC decide to audit. Well, they do audit all the time, obviously, they audit the portfolios, but just in case you sort of get a knock on your virtual door to say, right, we want to see your portfolio. It's never happened to me, and I'm at 40 years of nursing now. So it's not necessarily likely. So don't worry about it. So you're not submitting your portfolio unless you're unlucky enough to be one of those who's got to go through the audit. It's just the confirmation that you've done it that you submit, if that helps.
That's useful, yes. And you can very well do your revalidation very effectively without using the RCN revalidation portal. It's just the RCN revalidation portal is a really useful tool to kind of check things off and do things quite methodically and really make sure you're covered effectively. But if you can compile all of that in a folder the old-fashioned way, if that is a better method for you doing it, this is just a lovely additional part of your membership that comes free with your RCN membership. Who can verify my written reflective document? Any NMC registrant, question mark. They're all coming to you, I'm afraid.
In theory, yes, but most employers like to, or managers like to verify them. I have often not requested not to have a manager verify, because if you've been doing reflective accounts, you might not want to share them if it might be sensitive in any way. So it is your choice. In fact, I've had colleagues from other fields of practice who've done it for me, but who are peers. So as long as they're registrants, they don't necessarily have to be in authority of, or you know, a manager necessarily, but that might be the person you go to. But it does definitely have to be an NMC registrant, yes, and a current practicing registrant.
Yes, and it's worth having that discussion with someone you think you're going to get the most out of it with, right?
Absolutely.
So if you do have a trusted colleague that you know that you're going to have a really kind of progressive and useful conversation, reflective discussion with, you should by all means choose them. And my screen's flicking about. Someone's asked whether you can include annual leave hours as part of your hours. No, you can't. They do have to be your clinical practice hours or your hours that you use your registration in. I haven't practiced for more than a year due to a PhD program. Please, what is my fate? You do still have to, make those 450 hours and the rest of the requirements as we've indicated. It would be similar to those on maternity leave or those taking any other leave of absence from practice. You will still have to make those 450 hours. If not, you'll have to get in touch with the NMC. So yes, you still have to do the 450 hours. So start squeezing those in. We've had a few on dual registrants. If you work in a community but join a webinar for hospital workers, would this count as CPD? That's an interesting thing to discuss, I think. I mean, it's related to your point, Lucy, about the training needing to be useful for your clinical practice or your practice. Would anyone like to elaborate? Should we see if we can get Andrea?
Thank you, absolutely. The NMC want to know what you've learned, how you've learned, and how it underpins your practice. So if you do want to do something that's absolutely out with your practice, so if you're working with paediatrics, but you're particularly interested in care of the elderly, there might be a couple of points that you could perhaps take from that. So it might be communication that you've learned, something you might be able to go back and use your skills with your staff or with families. But they want to know how you've learned, how you continue to develop in your practice. And if you have a look at the link that's been in the chat quite a few times with revalidation requirements, it describes how you must do that. We've all got things we'd like to do, but when we're registrants, when we're nurse associates and we're registered nurses, we have to demonstrate what we're learning is we're going to use it in practice and demonstrate that we are safe to do that. Thank you. Can I ask Kendall, there's quite a lot of increasing questions in the chat about those hours. I've popped the link in quite a few times. There's a lovely table on there from the NMC that describes the 450 hours, which most people have to do, and those odd occasions that you have to do 900. It's really clear in that table. So please, everyone, do have a look. It's a great form from the NMC. Thank you.
Thank you. And this is a part of the hours question that we've not spoken about today. If you decide to do those hours overseas, does that affect your revalidation? I think the answer is no. They're still clinical hours and you're still using your registration. Does anyone else have any further points on that?
I think, well, to be registered as with the NMC, we have to be practicing. We have to be practicing to their standard. If you want to come back to the UK, we've got to have demonstrated that you have practiced in the appropriate to your qualification. Your CPD is appropriate to your qualification again. So, yeah, thank you.
Thanks. I'm sorry, I'm rereading the same question.
We're looking through too. We're with you, Kendall. We're just making sure we haven't missed any in between.
Yeah.
We definitely see there's some common themes, which is reassuring, isn't it? When you're new to practice, when you're new to revalidation, those common themes. But I do have to say that our colleagues at the NMC have got some excellent resources, and so have we. And my colleagues have put the RCN revalidation resource in there as well. There's a lot of information. And if you do have any particular questions, if it's getting to the date and you're worried or concerned, please don't leave it that long. Please contact RCN Direct. Please have that one number in your phone, because that's how you access all our services, and the team there will be able to help you, will be able to reassure you. They might be able to signpost you to things that you haven't thought of. Please contact RCN Direct as part of your RCN membership. And if you're not an RCN member, speak to your own trade unions or your practice learning development departments. Everybody's there to help you. There's a lot of information out there. May I add, Kendall, at this stage, that the revalidation and the nursing and midwifery code, to which we all practice, Lucy, Kendall and I, and Edward in education, is changing. They're doing a 2-year review of both the code and revalidation. And this starts in October and it goes over 18 to 24 months. So it is your responsibility as registrants to keep checking back on the NMC. They will inform you, but it is your responsibility to keep checking back. And they're really inviting people to come forward and help them. So the link will pop in the chat in a moment. But please go and say you want to be involved. You can help inform. You've got a lot to give. I will pause there, Camden. I'll just get the link and pop it in the chat. Thank you.
Thank you so much. That's actually a really useful thing to end our Q&A on. I think we've had some incredible questions. We've had so many people join tonight, lots and lots of engagement. So thank you all so much. Hopefully you have had your questions answered. If you haven't, please do get in touch. You can join the Early Career Nurses Network that will enable you to get in touch with us directly, and it will also help us send you information about stuff we're up to, so you don't miss future webinars. The webinar will be recorded, well, it has been recorded, and it will be uploaded online. And you'll get a notification of when that happens. If for any reason you do not get that notification, please check the Early Career Nurses Network webpage, and it will be there front and centre. My colleague Ollie, I think, has just put the the evaluation questionnaire for this webinar in the chat. I believe I've just lost access to it though, and we'd love you to do that survey for us, because we want to make these as useful as possible, and in order to do that we really need your feedback. I would like to thank you all for coming, and my brilliant colleagues Andrea, Lucy and Edward for contributing so brilliant to this session, and I'd love to thank the behind the scenes team too, John and Ollie from the AV team, Jitan, who has been chucking all those links in the chat for us, which have been super helpful, and actually Ben and Caitlin too, who couldn't be here tonight but have done a lot of the legwork in the run up to this session. And I think, on a very sincere thank you for attending and all for contributing, we will leave it there.